refreshing.
Okay, being 8:30, I'd like to call to order Public Health and Community Service, May 30th.
Is that issue, so we're going to go with that, so that can
I
apply.
get a roll call vote.
Hendricks. Ness.
Yes.
Yes.
Yes. Roll call, Ness.
Yeah.
Shorten.
Here.
Van Hoff. Present. Wagner.
Here.
Altough.
No.
Hamburgen.
Here. All right, next, could I get a motion for meeting minutes approval for March 28th? Wagner,
I'll second.
seconded by Mr. Shorten. All those in favor?
Aye.
Aye. Motion carries. We have any public comments?
We have none?
None.
Surprise, surprise.
Yeah, okay. Now on to member comments. Do you have any member comments? Definitely quite a bunch this morning. Okay, so we will move on to new business, and we have a couple interviews. Mr. Joseph Clarke is up first for the Board of Health. If you could give us a brief explanation as to why you're looking to continue. We thank you for your previous service. But just tell us a little bit about yourself and what you're looking to accomplish.
Okay. First, good morning, everybody. It's a pleasure to be here in front of the committee. It's also been an honor of mine to serve with the Health Department Administration, the County Administration, and the fellow board members for the past few years on the Board of Health. And I present myself here today to offer my services for another term. And a little bit of background. I live in rural Marengo. We live on a farm, my wife and I. We've been married 41 years, got 4 children, a couple of grandsons. Our farming operation is cattle, sheep, corn, soybeans. I also was a professional firefighter, paramedic for 31 years, having retired a few years ago. Thought I was going to retire and rest. It turned out just be the opposite with the farming. It kind of expanded over the last few years. So what originally brought me to the board years ago was my interest in emergency medical care, and having been trained in that and able to contribute to the topics on the board. I think the board, the department as a whole has been very progressive in the last 6-8 years. We've accomplished many good things. The one thing I am most proud of is how the board and the department stood behind patients' confidentiality when we were going through the COVID issue. And we were able to protect the privacy of patients throughout McHenry County and any of the guests that came through McHenry County. We've been working on a opioid surveillance program, trying to get advice and counsel to the local jurisdictions on how to deal with the rising incidence of opioid overdose and the consequences of loss of life. On that topic, the health department has been very proactive in getting Narcan stations throughout the county. Back in my days as a paramedic, when a patient had an overdose, somebody would have to find them, and then they would have to dial 911. We would have to pick up, press, go out, get on the call. 4 or 5 minutes later, we'd get on the scene. Well, that patient wasn't breathing for 4 or 5 minutes, and now damage occurs. Well, today with the action in part because of the health department getting the Narcan out, once they are discovered, with very little training, a civilian can administer Narcan and reverse the effects of the opioid, and hopefully prevent damage and save a life. That's been remarkable. Other things that I've been proud of that we've got accomplished, we've got a strategic plan done. That's laying out the future for the health department. We've established a more user-friendly application process for applying for permits, for getting inspections done, for obtaining compliance with complaints, etc. Our department's been very active in investigating health issues, salmonella, food infection exposures, where they've come in and been able to get on top of an illness outbreak and stop it so it doesn't continue and get everything corrected. That has been very good. We have been very active in establishing a good administrative team and begin the process of succession for developing the next tier of leaders within our department. Another feature that I'm looking forward to participating in is the development of a community health division, which will, instead of more focusing on catching illnesses and treatment, is to do more education to the public to prevent the illness or injury or like in the first place. And that's in its early steps and is moving forward. So those are some of the things that I'm proud of that we've done over the last few years. I'm interested in staying on. That'll do.
Impressive. Thank you. Thank you for everything that you've done the last couple of years. Are there any committee members that have any questions?
I have a question. Well, first of all, thank you. Thank you so much for stepping up, especially with your expertise in, being a rescue worker and bringing all of that knowledge. I just wanted, now is this the term you completed, was that your first term? I had you served.
It's my third term.
It's your third term, so wow. How many years total?
I'm finishing my 9th year.
Wow. Thank you so much.
You're welcome.
And so I wanted to ask you, you talked about prevention for the community health center. That is so important. How far along are we to maybe getting, and I don't know how much you can answer. I see Melissa is here smiling, but this is such a great idea because we know that so many, like the chronic illnesses, there's so many of them that are preventable. Top 7 or so. So how deep are we into getting something like that established?
Well, a lot of the services are currently being offered through the current divisions, but they come underneath what is typically a department that offers treatment or investigation. It's an auxiliary to the current divisions. What we're going to move towards is creating that as its own entity. So it's has importance equal to the treatments, to the other types of services that we offer. So I don't want to give the impression that we're not doing community health now. We are doing community health through the 4 divisions.
Right.
But we're going to segregate that off and try to elevate its importance and make it so it's independent, so it doesn't have to share its responsibilities with a disease outbreak or inspection of a building, a restaurant, or handling a dog bite or something like that. Instead of it being part of that, it will be of its own division to go out and educate and train and try to keep us as a healthier society.
Very good. And
And
I just have,
that's real importance of the Department of Health.
absolutely.
It keeps society healthy.
Yeah, and I just have one question. Going through COVID, so you went throughout for 9 years. What would you say your biggest challenge was as a board in dealing with that crisis? And if you had any recommendations for what we would do differently, not if, but when we get the next pandemic, what would that be?
First, I will say going into it, we hadn't considered that we would be in a position like this. Shoot, I had it to my phone. Forgot about that. From my point of view, watching how staff was able to respond to setting up testing clinics, setting up vaccination clinics, without any previous experience in doing this, locating the buildings, getting the vast number of volunteers to come together and respond to this crisis was remarkable. It really showed the talents that the health department has within its staff. People really shined. The one difficulty that I was part of was the litigation that took place as a result of trying to, on one hand, protect the safety of our first responders, but on the other hand, protecting the confidentiality of our citizens. And that was stressful and was resolved through the court system. Will be a good template for organizations throughout Illinois and the nation to use when the next one occurs.
Right.
So,
Thank you.
you're welcome.
Hi, Ms. Wagner.
Thank you. I applaud the department and everything that they've done, especially during COVID. I like the idea of having the community health programs all under one umbrella and revamping the building in Crystal Lake and especially the mobile clinic. I think that is just a wonderful idea to reach those people who don't have transportation or funding. So you talked about overdoses. And I was talking to someone from Lake County, an elected official in Lake County, and they were talking about a program that they're looking at and mapping overdoses so they can figure out where the troubled areas are. Is that something that the Public Health Board would consider doing, or do you? And maybe I shouldn't ask it that way. What way do you see that you can help fight overdoses? I mean, I know the Narcan's there, but what else do you think can be done?
Well, the occurrence of fentanyl getting put into our street drugs, I'm not defending street drugs. I wish I could snap my fingers and they all go away. But the fact of the matter is they're here. And we as a society have to deal with it. A lot of it is being introduced into the other forms of street drugs unknowingly. And so our victims aren't aware that they are taking these fentanyl-laced drugs. And that's presenting a problem. If we could, through enforcement or inspection, catch some of this earlier in the process as it's coming into the United States or coming out of any manufacturing facility in the United States, that would be helpful. Regards to finding hotspots, between data collection from the health department and from the regional EMS services, they are already able to identify. I mean, back on my day in the fire service, we knew when a bad load of drugs hit the streets, all of a sudden you get all these paramedic reports. And the local hospitals, they identify it pretty quickly, especially with computer filters and such today. The reports are being generated currently, and we can do it. It's my understanding that the health department in selection for some of the location for these Narcan vending machines has been based on where some of the hot spots have popped up. It would be nice with maybe the community health is when a hot spot pops up, if we could send staff to that area. Go talk to the kids in the schools. Give them some warning. Whether they listen, that's another topic. But we can do our part.
Thank you.
Welcome.
Any other questions for Mr. Clarke? Okay. Well, thank you for coming in and for your continued service. We have a few more interviews. You're welcome to stay in the audience, and we'll deliberate later. Otherwise, you are free to get to your day, and I'm sure you're busy. I'm sure there's something to do on the farm.
You may be the only one that understands this. Today's weaning day.
Yeah.
So,
You gotta go.
I gotta go.
Perfectly understandable.
Okay.
Thank you.
Have a good day, everybody. It was a pleasure.
Now, Cecilia.
Just let her into Teams.
Oh, okay, she's online. Hi, Cecilia. Welcome.
Hi, good morning.
If you could please take a few minutes and tell us a little bit about yourself and your interest and your continued interest on the Board of Health. And then we'll take a few minutes for member questions.
Okay, great. My name is Cecilia Carman, and I've lived in McHenry County for about 26 years. I live in Lake in the Hills. I'm a nurse. I've done a lot of different things in my nursing career. I did ICU. I did some home health. Now I'm case management for an insurance company. And I've also been involved in other things in the county. I'm a member of the Environmental Defenders working on waste reduction for the county. And I was a village clerk of Lake in the Hills in the past. And I'm also on the Parks Board as well. So I'm an empty nester and just using up all my time I can to serve my community. I've really enjoyed being on the Board of Health. It's really been eye-opening. I feel like I'm just really getting started. I feel like you really need to learn what's going on, listen, and really takes a while to get your groove on and understand what's the needs of the Board of Health. And I just really want to try to continue the work we've done, and I'm proud of what we've done already, like getting the passage of the increase of pay for our Hispanic or for our interpreters. Also, we worked on that. I really tried to initiate the shared tables for school lunches to help schools save money and reduce that food waste there. And I just would like to continue more into those kind of initiatives for the Board of Health.
Great, thank you. Do we have any member comments or questions? Okay, Ms.
So
Wagner.
thank you for reapplying. I think it's important that we have nursing staff on the Board of Health. So my question is, well, like I said before to other gentlemen, I applaud the programs that have come out, the revamping of the building in Crystal Lake, the mobile clinic, I'm really excited about, and all the efforts that you guys put forward during COVID. But my question is, when you come to overdoses in the county, what type of program do you see that, I know there's efforts being implemented, but increased programming that could be done to reduce overdoses?
Well, I think that has a lot to do with the education and educating the right people and getting to where those people are. I mean, you can put, a poster at the Board of Health, but those people are probably not going to be walking in there. So it'd be working with those places where they go and having that information there and making it accessible. I think the adding of the Narcan vending machines has been great. I know at MCC it's been emptied a lot, which is good that this people are willing to take it for that prevention. And I'm hoping that finding more spots and just educating the right people at the right places would really help with that.
Thank you.
Do we have any other questions?
Yes, Cecilia, my name's Gloria, and I just wanted to ask, I know you've been on, this would be a repeat term for you. So how long have you been on the health board?
3 years.
3 years, okay, so
Yes,
this would be the beginning of your second term, is that right?
yes, yeah.
Okay,
Yeah.
so I just wanted to ask, during COVID, were there any particular challenges that you faced that you would like to mention? And is there anything that you can think of that we can do better to prepare for the next time we have a pandemic or any kind of emergency like that?
Well, I joined like way at the end of the COVID pandemic, so
Okay.
I
You're off the
was
hook.
there in the beginning. But I did one thing that was so impressive that really made me want to join the Board of Health was I'm part of the McHenry County Reserve Corps, and I gave the vaccines, and those clinics were run, I mean, impeccable. Like nothing. Everyone was on time. People did not wait long. I gave a vaccine to someone from FEMA, and she said, "I wish FEMA was as organized as McHenry County Health Department." So we've already done a great job, especially with those vaccine clinics. And I think the main thing, as we all saw, is just making sure the right information is going out and being able to inform, like especially with the medications that came out for long COVID. I know there are still a lot of doctors out there who are against giving it, and just giving more education and finding out why, what are those barriers? Why aren't they prescribing it? And what we can do to promote what the CDC wants us to have.
Okay, thank you for saying that. This is the second time I've heard about how efficient the clinics were, so that's really good to hear. Thank you.
Yeah, Chrissy did a great job, yeah.
Thank you.
Any other questions? Mr. Hendricks?
Hi, Cecilia. So you listed 3 accomplishments and 3 challenges, and I'm just curious, can you tell me a little bit more about the amending of the school shared table policy? And then I guess the other one would be, one of the challenges you listed was the county board vision doesn't always align with the Department of Health. So I guess what's the most prominent example in your mind?
All right. Well, for the share tables, I work a lot with my work on with the defenders. I work a lot with other organizations. I would collaborate with 7 Generations Ahead, who work on school food waste, and speaking to schools, noticing that there was they weren't sure of what the rules exactly were. They felt like they weren't clear, so they were afraid to do the share tables. And so the schools that were implemented, we saw a huge change where one school in Crystal Lake, they had 70 carrots left at the end of the day, and then implementing share table and offer versus serve, they were down to like a handful of bag of carrots. So we saw a huge change in the schools that could implement the share table. Well, we saw a lot of resistance from other schools, so we spoke to Chrissy Miller and then to Patty Noom, say, hey, can you guys really make this more clear so the schools know, because there were some discrepancies between what the state law was and then the ordinances for the county. So Christy Miller to do a presentation, and now it's a lot clearer, and we're hoping that soon we'll get on the website and present it to all the schools, and we can promote reducing that food waste here in McHenry County. So that's what that's all about. And then, sorry, what was the other question?
The other question, you listed 3 challenges, and one of them was the county board's vision doesn't always align with the Department of Health. In your mind, like, what's the greatest example of that?
Well, one big thing I would say, like, if it's like the budget, not always, we always, there's always more we want to do. And I know like the county budget always doesn't align with that. I feel like that's one thing. I know during COVID, there was some resistance with certain board members on initiatives for the Board of Health. So I feel like right now, especially with Joe Clarke he did a presentation to the board, the county board, explaining what the board does, doing the annual reports. I think doing more of those things will help keep us aligned and understanding just a more communication, having our board president more in front of them, and just speaking more to the board so we can align our goals, and so we don't have any more discrepancies between what the Board of Health feel like is a priority in the board and the county board.
Thank you.
Any other questions? All right, seeing none, thank you so much for joining us this morning and for your service.
Thank you.
We have one more interview. You're more than welcome to listen in, and we will be conducting deliberations shortly.
Okay, all right. Well, thank you very much. I have to go back to work, so thank you.
Understandable. Thank you.
Bye-bye.
Okay. Do we have Rhienna McClain here? She wasn't online, was she? Mm-hmm.
So then, skip ahead to Robert.
Not yet? Okay. Well, Robert, I guess you're up. So.
Good morning.
Good morning. Thank you for joining us. This is for Lake in the Hills Sanitary District. If you could just take a few minutes and tell us about yourself and your interest in being on the Sanitary District.
I'm a resident of Lake in the Hills. I've been a resident since 1999. I am very involved in my community. I live in a HOA. I'm involved in my HOA. I'm also part of the Community Development and Housing Grant Commission. I like to see where my tax dollars are going, and having some say into how our money is being spent. I think that's very important. I really wish more people would be involved, and I talk to a lot of people trying to get them involved. So I want to give back. I want to be involved. So that's why I'm here.
Okay, Ms. Althoff.
I think that's the greatest statement I've heard in a long time. What do you know about the Sanitary District?
Well, I know they get rid of our dirty water.
I mean, have you ever attended any meetings? Do you know of any of the major challenges or issues that they're dealing with?
Not for the Sanitary District. I've been to plenty of meetings, whether it's county board, school board. I've been very involved in a lot of, so I know it's allocation of funds and policies and stuff along those lines. I've lived by the Sanitary District for many years, so I see what goes on there just from walking around it.
And so what made you decide? I mean, I know you wanted to get involved, but did you go on the website and see that there was an opening?
Yes.
Did someone, okay.
Yes.
Thank you.
Okay.
Does anybody else have any questions?
I guess I'll just ask in general, so I know you want to get involved. The little knowledge, I shouldn't say it that way, I apologize. The knowledge that you have of the Sanitary District, do you know of any challenges or changes that you would want to make?
Not offhand. it would take, you know, some more research into it. But I mean, with everything, you know, attending the meetings and being involved and stuff will help me grow, you know, in that area. So, you know, I mean, just to know where my tax money's going and how, having a voice into how it's being spent. So I just know my taxes are very high. I mean, and that to me is enough to get involved in whatever I can get involved in.
Great, Ms. Altoff.
And I'll just say, you know, it's always great to have a fresh set of eyes come in and be that open to seeing what's going on and listen and kind of understand and then have maybe a fresh perspective. So I appreciate that.
Thank you.
Do we have any other questions? No? Well, thank you for your interest. We will be deliberating now really shortly. If you'd like to sit in the audience and listen, but we understand if you need to get back to your day.
Okay,
Thank you for coming in, Robert. Okay.
Call. Do you care?
No, not at all.
So Tracy, while we're waiting, can I ask, I know that on the Board of Health, there's so many nurses, that there's so many slots for nurses. And I remember last time we appointed some people, Juliana was one of those nurses that came in a different way last time. So what are we looking at here as far as, so Cecilia would be coming in a slot as a nurse?
Yeah, so we have 2 positions open.
Okay.
And
one is for,
correct.
and one for a dentist.
Yeah,
Okay.
really that's the only requirement, but I think that's.
So we have one for a nurse and one for a dentist.
Well, I think
Well,
they're open.
No, I think
technically
it's
there's 3.
Two regular,
Yeah.
and then one dentist, but the
Yeah.
dentist,
Has to be a
no, yeah.
Dentist and a dentist.
We haven't found the lucky individual yet.
And we did, but then they went away.
Yeah, she just said she thinks she has a dentist, but that's for another time because there's no dentist currently.
Okay.
Yeah.
And are there any other openings coming up, or are they on like 2-year
I think
cycles?
next
3
year.
years, so,
Yeah.
okay,
So next
So every year
there'll
there'll be
be 2 more.
2 or 3 people depending on the cycle, yeah.
okay.
Because they're staggered, right?
Right, plus, you know, when we have a vacancy with a dentist, right? So typically it's roughly 3 people every year who are gonna roll out. Or 4, because we're.
I know the dentist position has been difficult to fill. Has the nurse spots, aren't there portions of the board that are allocated just for nurses?
Yeah, you have to have 2 physicians, a registered nurse, and a dentist, and then the county liaison.
Have we ever had difficulty filling any of those positions?
The nurses seem to be pretty available.
Yeah, at least not since I've been here.
Okay.
Yeah, and we have more physicians, right, than because physicians have a natural affinity, I think.
And I think we may have a dentist applicant. So.
I hounded my dentist, but he joined the conservation district, so.
There is, and just for your edification moving forward, there is a dental association, there is McHenry County Dental Association, and we did
Could
approach
we-
them and we
okay.
did ask them and did get a name. So in fact, I just told Melissa this morning, he's a dentist in Woodstock, so we'll reach out to him. And we did have one, and then his practice relocated, and he relocated.
Okay.
So we really have 2 candidates in front of us right now.
For 2 slots.
For the Board of Health.
Yeah, for the Board of
Yeah.
Health. How long are we gonna wait?
I just tried to call her, and I got no answer. I got
Okay.
her answering
Okay. Well,
message.
how about if we move to 5.6 and deliberation for the Lake in the Hills Sanitary
Sure.
district.
I make the motion.
All right, Mr.
Second.
Hendrick, oops, seconded by Ms. Altoff. Any discussion?
I think it's nice to have new people.
Yes, I agree. I agree.
So we have one slot open and we have one applicant.
Yeah.
Okay.
Essentially, yes.
Okay, all right.
Well, we could continue to advertise and look for more, but I think if we have someone who's eager to do it and is interested in being involved in their community and willing to step up, I think we should consider what's in front of us.
And I just heard from Rhienna too, so let's finish this.
Okay. I can say that Mr. Reining has done a fabulous job in on community development and housing. You know, he's had no experience with that as well, but has stepped up and has been a great contributor, you know, to that commission in asking great questions of, you know, everybody during, you know, allocation and presentations. So, you know, I really think he will do a good job.
Well, I don't see people beating down the door to be on the sanitary district, though it is very important work, very important.
Sometimes some of the more,
important than
yes.
people think. So, yes.
Yeah, just have it not work. That's
Yeah.
really important.
That's right, that's right. We pay plumbers $125 an hour.
Well, I think we've had the position open long enough to attract, it's always good to, you know, to hear from different applicants. But we've had that opportunity for people to come forth and, you know, I'm glad that you're here, Robert, and I think we should go ahead and make that decision.
Okay.
Do you want me to put that in the form of motion?
We did do a motion.
Yeah, we
We
have a
did
motion.
Okay, so discussion, so now we vote.
All right. So, all those in favor?
Aye.
All those against? Welcome aboard.
It's yours.
Yeah, break out the champagne.
Go clean that dirty water.
You're in the
Yeah.
deep end now. You're in the deep end now.
There's a song, isn't there?
And I live in Lake in the Hills, so if my water's dirty, man, I'm very upset.
I got my waders, so we're all good. I'll make sure it's clean.
Well, thank you for coming forth, and we do appreciate that.
Did you get it?
She's what?
Rhienna is emailing Kathy. She apologizes. She has it on her calendar for tomorrow. That's why she's not
Oh,
here.
no.
Would she like a Teams invite?
Pardon me?
Would she like me to send her a Teams invite? I haven't gotten anything from her.
I don't, yeah, why don't, let me
That's
see.
good.
Can you zoom
I
in?
would say just send it, and then we'll give, well.
Yeah,
I don't
well,
know.
we have
I guess
plenty
that's
left
up
to
the
do.
board.
No, she's not a dentist.
She's not a dentist.
No.
She goes to 1776.
She was on the board.
Yes.
She
Yes,
served on the
she's a
board
dentist.
previously.
And we have a slot, we have an open slot?
No, there's two
Two
openings
slots,
and
three
three apps.
people.
Okay, so this
Well,
person,
I think we have enough on our agenda that if she's able to join us by Teams, we
yeah.
can move her
And
down.
she hasn't responded, I don't know.
okay.
Okay. Well, let's move on to then the routine consent agenda. Are there any items anybody would like removed for discussion? Okay, seeing none, could I get a motion?
I'll second.
All right, Ms. Wagner and Mr. Shorten, and a roll call, please.
Ms. Ness?
Yes.
Wagner?
Yes.
Hendricks?
Yes.
Roloff?
Yes.
Shorten?
Yes.
Altoff?
Yes.
Von Bergen?
Yes.
I think you said yes for me too.
I did. I heard off.
But it was
I
yes.
heard off, sorry.
That happens a lot
I was a little slow in the uptake here.
And there was one miss, and the rest were last names. You were Miss Ness.
Pardon?
You were Miss Ness.
Sorry. I was quite popular in Scotland. There's a lot of Nesses.
These, Including lock.
I was gonna say, not to be confused with the lock.
Yeah, and I didn't tell him I was Italian, so.
Okay, we will move on to discussion. We have review of the health department fees, and this essentially stems from my request to look at waiving the inspection fees for the food pantries. I think it's incredibly important that we do that. That's, the food pantries serve our most vulnerable populations, and, we don't have very many of them. The fees may not impact the bigger food pantries as much, but the smaller ones, I believe the fee is $175. That buys about 25 to 30 pounds of meat for the food pantries. And meat and protein are always, I think, a struggle for that population. So that's why I would like to see it move forward. But with that, I guess Patty is here to, talk with us about.
And just clarifying for Patty too, we're not saying no inspections, we're just saying no charging for those inspections. Okay.
Right, the first part is not optional.
Right.
We have to do the
Exactly.
inspection.
Just clarify.
Yes, thank you, and important clarification. So I mean, do you all want us to talk to how is, the process for the fees? Or is that, that is the request, is to waive fees for the food pantries? Because they are set through the ordinance, the Board of Health reviews that. We are actually going through the ordinance process right now. And those fees are traditionally set based on the services that we provide, which is how the state statute and Board of Health bylaws are set. It is done differently, so there is every county in our area. Patty did some analysis. It varies how they treat food pantries and in some cases nonprofits. I would just caution, this is certainly a discussion that we can have, or we could move forward with waiving of fees, but that we would have to look at the ordinance for the long term and just, be mindful of, is it a slippery slope? Are we just going to make this narrow focus? Because those services we still have to provide, and that could have impacts on budgets. It could also, where do you draw the line?
How much revenue do you generate from food pantry inspections?
That part is pretty low. I think based on the 13, it's under 3,000.
Well, we have 21.
That was my question.
I would be
No,
interested,
jump in.
I would be interested in finding out what Patty found out about what other counties are doing.
Could I ask my follow-up?
Oh, I'm sorry.
So, I had my hand up first.
I didn't even get a follow-up.
I just waited to be called on. So, if you were to go and inspect something for Pioneer Center, I'm just using this as an example, would you charge the same fee for them as you do for the food pantry?
No. So this is why that's a really, really perfect example. So Pioneer Center.
Can you come up here just?
Sure.
Please join us.
Do you want me to join you, or I'll just cheer from the background?
It's a really good example because of those 21 food pantries, 3 of them are already permitted under some other category. Pioneer Center is one of those. So if they're already permitted under a category, we don't pile on the categories, right? They're just under one. So in that case, yes. But if you're saying, were they doing something else, would we, we are permitting them because they are a food establishment by the regulation that I follow. That's why they're being permitted. Does that answer?
Yeah, it does. Thank you.
No, Gloria, go ahead.
No, you had your hand up. Go on.
Go ahead, Ms. Moulton.
And I am guilty of flirting. I am guilty of flirting. I guess my question is, can, first of all, who has the authority? Is it the Board of Health that sets those things with the review by the county? How does that process work?
Yes, so it starts at the Board of Health. So when we bring the ordinances through like we've done in the past, we will draft them, then it goes through the Board of Health for approval and recommendation to come here, and then through the rest of the county board process, right?
And I'm assuming you're also restricted on that same wonderful thing that all government is restricted. You can't charge more than the cost of providing the service.
Correct.
So somewhere in all of that, we're saying it costs us $175 to do those inspections.
Right.
Okay, so if it's only, can we come up with a definition that it's only the 21 food pantries and not anything else that falls within that category, so that it doesn't harm any other inspections that you're doing?
Yes, I could do that, exactly.
Oh, okay.
So we don't, I didn't mean to interrupt you, Pam,
No.
but we don't currently have a category specifically for food pantries, right? So when we set this up and we knew we had to move forward with this, and other counties in the region are kind of struggling with the same thing, is that we put them in, you know, what the smallest category that we had, that's how we got to the 175, so it's an institutional category at the lowest risk. That's how we got that one. So we have kind of a complex fee schedule, you know, trying to capture our costs based upon complexity of the operation and also the size of the operation through receipts and things like that. So that's how we got to it.
And then ask your question, because I think
Yeah, and that's a perfect segue, because you said other counties are struggling with this too, and I'm thinking that they have come up with some solutions that might work for us.
Okay, so you want me to then
Yeah,
kind of talk about
yeah.
that? Yes,
Or maybe not.
I'm happy to do that. So, you know, well, as Pam said, you know, we take our costs for the entire food protection program, you know, and spread it out over the entire program. So, you know, the inspections are part of it, but then there are a lot of other costs and there are direct costs that would not be, you know, you might not think of. So we have the administrative cost for processing it, internal things, complaint response, other types of inspections that we do that are more than just the routine inspections you'd expect each year. So then, like I said, we try to do that. So, but to answer your question specifically, so I really went into all of their fee schedules. And so definitely, I'll just call out the counties for you, okay? So Kane County does exempt the food pantries or soup kitchens, and their thing is no charge to the consumer. So that's kind of how they're, you know, narrowing that a little bit.
Okay.
Lake County, similarly, they're also continuing to identify those, but they exempt them from fees. Will County offers a 50% reduction, and that carries over to others like churches, governmental entities, stuff like that, so it's kind of 50%. And then Kendall County does the same with a 50% reduction. So yes, there are counties that are addressing it that way.
Okay, thank you. That's very helpful for us, because I think what Tracy is asking is not, you know, that there's precedent for other counties doing that. I do hear what you're saying with that slippery slope, Melissa. So I think anything, you know, either just eliminating it or doing a big reduction, you know, or something would be good.
Is there no, I apologize. See, is there a difference in size of food pantries? Is that anything that we should consider as we move forward? I mean, I know that some are larger. Is there some measurement, budget, square footage, something that we could also, I mean, at least consider? Not saying we would do anything different. But.
So the way we do it is really by risk classification, so complexity of the operation. So the majority of them, really, also a really good question, the majority of them are doing exactly what you said, Tracy, that they receive the food, they control the temperature of the food, and they, you know, distribute it. So it's really, we consider it low risk, right? So it's temperature control primarily. Then we have like Crystal Lake Food Pantry, much larger. They do demonstrations, things like that. And really, they had come to us originally, and they wanted to be permitted because they wanted to do additional things. So I would say, I mean, my recommendation would be to limit it, you know, to those kind of flow-through pantries. They're receiving food from another entity. They're controlling that food while it's there and passing it on at no cost to their consumers. And I mean, I think that's a very easy way to kind of compartmentalize those smaller ones, if that's what we're trying to do.
I think that, I can't speak for you, can't speak for anybody here, but
Yeah.
I think that that's more what you're trying.
Yeah.
Those that are really
exactly.
just serving the community by collecting food and then distributing is who we want
to. Well, and some of these food pantries, you know, they raise their own funds to purchase food and, you know, and raising money can be really difficult when you exist on a shoestring and you're just trying to feed people. So my question is, if we do this, do we have to modify the ordinance or?
Not right now. I have the ability to provide that waiver.
Okay.
However, for the long term, right, so anyone who's paid their permit fees for this year or anybody who is in the process of getting permit, we can waive them for this year. But yes, we would want to update that in the ordinance so that it was clear moving forward, which would be done before the next fiscal year.
And our permanent fiscal year is May 1st for food establishments.
Okay.
So it gives us time to do.
Yeah.
So most have already paid.
And we would
for
refund
2023, 4.
Actually, it's 24, 25, because
Okay,
it's May
24,
to April
25.
30th of next year.
And
So we can identify those easily.
would it be difficult? Is it a huge
to
administrative
do a refund.
thing? Yeah.
No, we've done it many times for other things. And we did something similar during the pandemic. We gave the restaurants a break. Yep.
So do we need to do anything?
We have to eventually pass an order.
Eventually.
Yeah, but
Thank you.
not today. If that is the, you know,
With the.
Is anyone opposed to this?
I'm
No,
not, that's a
okay.
great idea.
I wanted to parcel it, a little bit about who we waive and who potentially, because I do know that there are different operations of food pantries.
And I think that's
Very
important.
familiar with Crystal Lake, yeah.
Yeah, just for the reason that Melissa said.
Yes.
Slippery slope, you could end up with people out there that are, you know.
well, I'm sure there's many people who, you know, would wish not to pay those fees, which is, you know, I think we can respect, but that the work does have to be done no matter what. So it is important, are we philosophically saying as a county or as a department that we charge reasonable and necessary fees for the work that
Yeah. I would only ask that somehow we have an official action or whatever to waive, and that Crystal Lake be notified if we're gonna treat them differently because they operate differently, that they understand that that was the distinction, just as a courtesy to them.
And they've reached out to us, so we'll be in contact with them
Right,
specifically.
I just
too.
didn't want them to hear we were waiving fees and we didn't waive theirs.
Yeah.
Yeah, but I think that higher risk level, it does entail
They chose to do
more, it entails more work for the health department.
And then they're actually much more like another type of food establishment when they're doing that level of work compared to what some of those smaller ones are really trying to accomplish.
So in our ordinance, that you could address that, those larger, you know, entities that are doing more than just getting food and distributing it.
Sure, I can define that actually in the ordinance, and we'll bring that forward as a package through the regular, you know, process then.
So in the meantime,
We're gonna waive.
we're gonna waive, and do we, to accomplish that, go ahead, Ms.
No, go ahead, finish. I'm
To
gonna make a
accomplish that,
What, Pam, you're gonna make a suggestion?
Yeah, we're talking about all this. Why don't you ask if we can have you on the next Board of Health agenda and you come with what we talked about and say that that's the direction we would like to go in? Because we just did talk about some of the challenges between communication of Board of Health and the county board. Why don't you take that opportunity and do that at the next meeting? That was my suggestion.
Yeah, Ms. Alta.
I think you're being voluntold.
I think so.
But I do, I think that those are the kinds of things that we as board members expect of committees and other entities that we have some oversight of. We should do the same, right?
Yes, I think that's, yes. That's a good norm to develop. It works both ways.
Could I just get a clarification on that? I'm sorry. Since the public health administrator has authority just in her position to waive fees, you know what I mean, based on need, you don't want us to wait until the Board of Health meeting to do that. We can proceed with the administrative process or.
Yeah, but I think it does set a nice relationship between the two entities.
Oh, yeah, I just want to know
Yeah.
process if you need me to.
I think we can proceed, but then communicate.
Well, that we're asking them to change the ordinance with this very specific designation. right? That's kind of why I would go to the
Yes,
Board of Health.
exactly.
We're already, thank you for waiving the fees, right?
Just
Thank
to-
you for waiving the fees, but, you know,
Just to be clear, the county board changes the ordinance, correct? Or does it first have to pass the Board of
Yes.
Health?
Yes,
Yes.
it goes through the Board of Health
that's
first,
why I
Okay.
asked, yeah.
but it absolutely comes through all the.
Is that is that like based on practice, or is that just?
It's in the statute.
that's.
And
By statute,
we
okay.
post it for public comment, we reach out to our regulatory
And then it
reviews. So we do the
comes to
same
us.
process
Okay.
that the county does for its ordinances.
The entire fee ordinance will be kind of up for the annual review this summer as part of the budget process. And the entire fee ordinance will be on 30-day review in October and probably voted on the same night as the budget in November 25. That's the traditional path.
Process.
Right, and at that point, you can carve out that special niche for food pantries more formally. But in the interim, if the direction is just do the wave, you can do that for the balance of the year.
So can I, when we're talking about process, so you said the permitting year starts in May 1st. So everybody has already pretty much paid for this?
They have.
So we'll waive anaiybody who happens to come forward later, but we'll refund everybody else.
So we have 7 or 8 that are in the process, and we'll waive that.
They
We'll
are.
do that by notification. And then when Melissa approves that, then I will go ahead and do the refund process for the other ones that have already paid.
So you said there's some that are in the process, but was the deadline May 1st?
No, there is no deadline. Sorry,
No,
Melissa.
you go ahead. No, go ahead.
This just comes about because of the Northern Illinois Food Bank wanted all of their recipients to be also permitted, to make sure that, you know what I mean, they're compliant also. So other counties are doing the same thing, still trying to identify, make sure we've captured all of them, go through that process. Those are the ones I'm talking about in process. We're still working with them to get that permit, yes.
So if somebody, is it a year? So they
Yes.
have to do it every year by a specific date?
Correct.
If they're late, do you assign fees?
Yes, so what happens with those is we have a grace period afterwards, and then we have an option for facilities to get a temporary permit if they're struggling financially. But yes, then there would be a late fee, because really, after the end of that, if they don't have not paid the fees, they don't have a permit, and actually then they're really closed until we resolve that issue. That's really practically what happens from a practice standpoint.
So I'm wondering if somebody is late, are we going to keep those late fees?
I don't believe we had any for any of them.
Okay, I mean, in the future, let's say somebody has not met their deadline and to be permitted.
Well, if
I think we're only gonna have
waiving
one.
the fees, right?
Is that the question before us?
No, I'm just,
Yeah.
I just, it's a good, it's a good conversation, so everybody understands potential ramifications.
right,
And
because
I would answer no, I don't think so. That's
I
not what
would
I'm
agree,
hearing.
they wouldn't, if they were late and the process wasn't completed,
Right.
they wouldn't have any permit,
They're just-
correct, Patty?
Right, that's correct, but I would tell you this, when it's coming down to the end of the thing, we are on the phone calling people, because the last thing we want to have is a school or someone providing, or a hospital or something like that. It doesn't happen, because we really just try to work through that to get it done. So
Okay.
we would show up the next day and say, you can't serve food to the needy people, right?
Right.
So, don't
just
worry.
wanted to make sure.
Building on that, is there a potential then, talking about administrative fees, that some of the other costs may increase? Or the loss of $3,000 is not that big of a deal? Bigger conversation.
Bigger conversation, but just keep in mind, our fees compared to the other counties are extremely reasonable. So when they say, you know, they're reducing the fees by 50%, it's 50% in some cases of more than we're charging across the risk categories. So,
Again, my point was, you know, as we do these things, I just want to make sure everybody understands that there may be potential ramifications on the other side, which may be an increase in fees overall, right? Because somewhere you got to come up with the money to not charge anymore, that's all.
But in most cases, isn't this the first year we're charging those fees?
It is for most of them. The Crystal Lake one's been permanent for, several years. But to answer your question, yes, we go through that process of looking at the cost of the program and evaluating, is the revenue sufficient to address those direct costs? So that's part of the process. You're right.
I don't want anybody to say I didn't know that.
What
I did know that.
is the approximate total revenue generated through this
Food
type?
protection?
Yeah.
So food protection, that's approximately $470,000
Okay, and we're talking 3,000.
out of this, yes.
Okay.
Mhm.
What was it last year? What would have been our total brought in for last year
Total
for the food pantries?
For food pantries?
Yeah.
I think it was probably about half of that. Let's just say, let's say $1,200 or something, right, based on what we had approved, something like that.
Okay. Okay, so we have a general consensus to ask Melissa to waive the
Waive
fees,
slash refund
inspection
fees,
fees, and refund.
Can I ask, just make sure that we report that to the county board, that was the end result of your proposal? There is not a resolution that we just asked, and the director, public health director has the authority to waive, and we'll be reviewing it with part of the budget comes forward. Just so that, again, really big into communication this month.
Yeah, yeah.
Just this month.
Just this month.
Just this.
Yeah, because
Next month I may
they
not be.
probably have been waiting with bated breath since you announced that you were gonna do this.
Yeah.
So-
I'm sure everyone will remember that.
It'll be known as the
It'll be what
Tracy Von Bergen ordinance.
That's okay. Thank you so much for coming in and
Absolutely, thank you.
clarifying
Yeah, thank you.
and talking to us about any
Yeah, and-
potential issues.
And thank you for looking at what other counties
Oh,
are doing.
absolutely.
I'm
Yeah.
always interested in that because we can learn from, maybe something did not work for them, so we're not gonna do that way. Or something did, so it's always good to see what they're doing.
Absolutely. Thank you.
Thanks, Patty.
Thanks.
Okay, I see we have Rhienna online now. So we are gonna circle back. Good morning, Rhienna. Thanks for joining us.
Sorry about that.
That's quite all right. If you could take a couple minutes and tell us a little bit about yourself and your interest in the Board of Health position, and then we'll have a few minutes for member questions.
Sure, absolutely. Again, my sincerest apologies for missing today. I actually had it in my calendar for tomorrow morning. I usually have my children Monday through Thursday, so I apologize. Thank you for the opportunity to talk with all of you. I am, a Crystal Lakean. My parents and grandparents were from Crystal Lake. My grandmother was Baskin Robbins in Crystal Lake and Woodstock for almost 30 years. I kind of grew up behind the counter, got to know everybody in town, so it was a really great opportunity for myself and my family to get back to our community. Didn't think I'd be a restaurateur, wasn't in my wheelhouse to start. I went to school for television and got into the nonprofit world, and I say I bought my own nonprofit, 1776 restaurant. So yeah, it kind of fits with my personality. I love to take care of people. My community presence has been pretty great, giving me a lot of a voice in the community as well. But yeah, I've got 3 kids, divorcee. My daughter's going to state tomorrow for Crystal Lake Central Tigers, Lady Tigers, so that's exciting. We just had their party last night at the Airstream. It was a private party. But yeah, I mean, it's been a really fun journey. It's been a very tough journey, obviously, since COVID. But the restaurant gives me an opportunity to serve a community, I think, that gets forgotten a lot. I have celiac disease. I don't know if everyone's familiar with that, but which means I'm gluten intolerant. I also have 30 other additional allergies. I have Lyme as well. So we kind of create a space that we say everyone deserves good food. So regardless if you are, just an atypical human or you have specific allergies that need to be accommodated, you can eat normal and comfortably in my space, which I think is kind of an anomaly because most of the time I don't eat anywhere because of that. And it's hard to dine and share and break bread with people if you don't feel comfortable. So I hope we create that space that you wouldn't know unless you know. But yeah, I don't know. Sorry, is that what you guys were looking for?
Can you talk about your prior service on the Board of Health?
Sure. I think I was appointed back right before COVID-19, if I'm not mistaken. Chris Christensen nominated me to be on the board, went through the process, and then COVID hit, right? I unfortunately, obviously, had to try to save my business. I was also getting divorced at the time, and I did get diagnosed with Lyme during that whole process as well, so I was in active treatment. Board meetings were kind of all over the place. You know, obviously that was a pandemic. No one knew what to do. There was a lot of things to figure out, right? Personally and professionally at that time. So I did have to step away. I did resign and did not fulfill my whole term. But you know, that was kind of a weird time in everybody's life, so.
Does anybody have any questions? Ms. Wagner.
Thank you for applying. I applaud you wanting to step back in after having, gone through so much and being on the board and having to resign. Just wondering, have you attended any of the Board of Health meetings, and what do you see are the upcoming challenges?
I have not attended any since I've left. Is that the question?
Yes.
Sorry. Okay.
Yeah.
It's a little bit of a delay. I apologize. I'm just trying to make sure I'm captured. No, I have not been, as of late, I have not been to any of the board meetings. I know the work that I was trying to do when I was there. I'm a huge culture person. There's been some, internal challenges with staff retention. I was part of the hiring process for Melissa, which is a very interesting, eye-opening, not coming from any type of government agency. That was a very interesting process to navigate. And I think that there's some challenges along the way, because in a post-pandemic world, things look different, right? There's more outside dining, there's more flexibility. There's people that are still on both sides of the spectrum of like, will not dine out, want to eat outside, don't care, don't think that it actually happened. It's like, there's this weird kind of vortex right now of people on both sides. And I think that it's a unique opportunity and time to really dive down and make sure that we're doing what we need to do to keep people safe on all aspects, right? Obviously, I'm more driven by the environmental health side of the Board of Health, just because that's the life that I live. And I think that presence needs to be on the board. I was a little bit disappointed to know, and Joe Clarke, the chairman, is a Wine Locker member. We become really good friends. We were on the board together. And he kind of keeps me abreast of things going on. He asks my opinion on certain things, just because I'm in it, right? I'm living that. But I do feel like there's some strong things around culture. There's some strong things around adopting maybe new codes, thinking outside the box to keep people safe. And I think, in a world that's unpredictable, there needs to be some flexibility, and we need to kind of figure out where we go from here type situation to continue to keep people safe. That's really my biggest thing. It's just, someone in the room has to have a voice that lives in it, right, too. I didn't realize that someone hadn't been on the board that was in a restaurant tour since, I believe, the gentleman who had the barbecue place. I think that Rachel from Cafe Olympic as well, if I'm recalling properly, was on for a little bit. So without having some fair representation, I think there's a gap from being, totally transparent and being able to push things along, so.
Thank you.
Yeah.
Mr. Hendricks.
So, in one of your answers, it was provide a list of challenges that they're facing, and you said that the restaurant industry, there's a disconnect between the Board of Health and the restaurant industry. What's the most prominent example, in your opinion, of that?
So, I mean, I am the president for the Illinois Restaurant Association for McHenry County as well, and obviously we're we're very different than the city of Chicago, but we need to be more congruent and in a bigger, there's a lot of us leaving, I'll be honest with you. I can be quite frank, we're down 10% in April from last year. Overall, I'm down 4% in general. So it's a weird time to be alive, I keep saying that. More people are choosing, I'm at the top of the food chain. So more people are choosing, to not maybe have those 2 entrees and do a couple nosh, and maybe not visit me every week, and maybe visit me, once every quarter or whatever. It's just a weird time. I think a lot of missed opportunity at this point to be more in partnership with restaurants. Traditionally the health department, people kind of like, oh, they're here, I would like to see that culture change. I said that when I joined the board last time, more education. That was kind of the mission of the health department, is to educate and inspire and make people, keep people safe, right? I think maybe some of that's not happening. If things change, restaurants need to know if codes or any type of policies, things like that. And I get it, we're all understaffed, we're all trying to do our best. But I hope I can be a bridge between the two. Obviously, Cook County and Lake County have very different ways of doing things in their health departments, but I know that they meet all together. But I will tell you that I don't think that there's a great relationship between all the restaurants locally and the health department. I'd love to work on that as well, like I said. But having help from the city might be a great opportunity as well to have their leadership. We hosted a roundtable for one of it didn't pass, but there was something on the table for legislation that would remove the tax credit. And so we utilized our resources in Chicago out here to educate people. And a lot of people didn't actually understand what the tax credit was. And Pam was so gracious to show up, having all of her work down in Springfield, and really gave a lot of the local restaurateurs information that they wouldn't have had otherwise. So I think there's a way that we can loop all of that together to really have more of a partnership mentality than it is, I think, right now.
See, communication, it's big this month.
Thank you.
Yeah. Pam, did you have any questions? Okay. Well, thank you so much, Rhienna, for joining us this morning. And thank you for your interest in serving. I understand as a small business owner, it can be challenging, and communication is always something that we need to work on between the government level and our businesses of any size. But small businesses do struggle with information, and a lot of times they don't pick up on new ordinances and so forth. So I appreciate that. We're going into deliberations shortly. You're welcome to stay online and listen, but we completely understand if you need to get on with your day.
Okay, I appreciate it. Thank you, Ken, and I apologize for missing the whole thing. So
Thank you for joining by Zoom and making the time. So we appreciate that too.
Thank you, Pam. I appreciate it. All right, well, have a great day, guys. Thank you.
You too. Thank you.
All right, bye-bye.
Okay, so I think we can move back to 5.5 for deliberation and selection for the Board of Health. So we have 2 positions. Ms.
I just want to note again, because the statute requires so many nurses, so many doctors, et cetera, where are we with that? I mean, are we limited on our discussion? Because I know we have 1 nurse.
I've got the list of.
We have 2 on the board,
We
so
have
we're good.
2 nurses right now.
Yes, Juliana's still.
And we just need the 1. So.
I'm sorry, you said we have 2 nurses on right now?
Well.
We have 3
Cecilia.
on, right. And so if we didn't appoint, we still have 2 nurses, which is a requirement.
Oh, okay.
Melissa, I
Just
showed
1.
Juliana and Sarah Clarke as registered nurses
Sarah
besides
Clarke is.
Cecilia, correct?
I would have to double check if Juliana is still, She's registered, she's retired. I
Okay.
don't know if she still is registered.
So are there potentially 5
You mean,
nurses on the
if
board?
she's still a registered nurse?
Um,
She's retired,
Either
but I don't
retired
know
or
whether or not
registered.
she's
Registered, she
kept
can
her
still, yeah, she kept her certification.
license
Yeah.
up to date.
She's up to date, I know that.
Oh, well then, okay, answers the question.
Thank you.
She is.
Yeah,
Thank
she
you.
is.
and then I show Sarah Clarke and Cecilia who interviewed today.
Right.
Okay, Mr. Hendricks.
I would move to nominate Ms. McClain to one of the open positions on the Board of Health.
I'll second.
Mr. Shorten seconds. Any discussion?
Should we usually, I think we changed our process so we can have discussion about everybody before we nominate. Can we do that?
Well,
Is there anybody that has any comments about any of it before we just start nominating? I'm not opposing her at all. I just want to make sure everybody has clear communication.
I would, that question I would ask, I don't care. I mean, how you want to do it. It's discussion now anyway, right, before the nomination. So I just, again, rationalization as to new person as opposed to the 2 that were served and have not had more than 1 term.
and apparently we have, I'm still not 100% sure, but potentially 5 nurses?
No.
No?
No.
How many?
So.
3.
3
3.
plus?
No.
No, okay.
Cecilia, she's one of the 3.
She's one.
Got you. So we have 3 nurses.
Stated better.
So I know restaurants got hammered during COVID. I do think it's important. My uncle had a restaurant that closed down after, it was a family restaurant that opened for like 3 or 4 decades. I know they got hammered. I think it's important that we have, first off, new people, fresh faces, and then second of all, it sounds like Ms. McClain is very, very involved, has some ideas, is in touch with the restaurant industry. It's obviously the restaurant industry is impacted by the Board of Health's decisions. I think she would bring a good new fresh perspective and kind of diversify the viewpoint or the experiences of the board.
Can I ask, do we have any other restaurateurs on the board?
We have in the past.
We don't
Not right now.
But one did not, like last year, I think, the last restaurateur that was on the board was up last year and did not get their application in. So then they rolled up.
And I would just say that the conversation is do we want to diversify the board? I think all 3 applicants are phenomenal.
Yeah.
I have worked with
I
both
agree.
Joe and Cecilia and they bring great perspective to the board. But if we're talking about diversifying and having different representation from throughout the county, then that makes sense to me if that's a desirability of the committee.
I think it's a difficult choice because we do have 2 members. Mr. Clarke, I think, said he's been on 3 terms. And then Ms. Carman is on her 1st. But the diversification, I think, is important. We do still have 2 registered nurses. And I'm not advocating for, it should be clear, whether the second spot would be Mr. Clarke or Ms. Carman. But I think having a restaurateur on the board, especially one that's associated with the Illinois Restaurant Association, has connections into that community, I think that's important to have that different voice there.
And I'll just add in, and I know we're not discussing that because there's a motion on the floor, but under Mr. Clarke's leadership, I have seen an unbelievable change in professionalism and conversation and direction. And I worked when I first was appointed to the Board of Health. Mr. Clarke was in charge of the Personnel Committee and did a yeoman's job and now has been elevated to the overall chairmanship. So, I mean, I would hate to see us lose that leadership at this pivotal moment in time. Just so you're thinking of that, that's all.
Yeah, because we only have 2 openings, right? So, yeah, I agree. I would hate to see that go. I have seen the professionalism with him and just his overall thinking and everything he brings.
He's remarkable.
Yes, so I would hate to see that. So it comes down to, Cecilia.
So of the three candidates in front of us, two have faithfully been to board members, served their terms, done their work on the board, are asking to be reappointed to continue to do that. And while I do really appreciate and value diversity, if I'm going to put the candidates next to each other, I'm inclined to lean into people who have the background and the history and the knowledge of how the Board of Health works and anchoring that in. Now, saying that, it's not, if we had a third opening in a heartbeat, I would say that. But since we only have two, and I know how long it takes, coming on the board myself, new, it took me almost a year before I felt like I actually had some sea legs under how the county board functioned. And that's my thing, and because they're coming back and they're asking to be reappointed, and to my knowledge, they have showed up at meetings, they have done their work, they have done good work. I'm inclined to go with the two that have been here and been, done their, that's my inclination.
I agree, and I asked Pam, when's the next opening, because, if Rhienna is really interested, we have an opening in a year that could be available and could move her into that position, but we have two people that have been there and have had that experience, and I would like to continue with those two.
Melissa, what are the next two terms? Are any of them?
That's what I was going to ask you.
Okay.
Great question.
Yeah,
No,
I'm just
great question.
pulling that up in case
Yeah,
that question.
I have it
Oh.
pulled up. So Kyle Markuson, let's see, is on 25. Melissa Katz, who's the PhD,
Cindy Gaffney.
and Cindy Gaffney.
Yeah, so 3 people next year.
And what are those, are they the general slots or the nurse, dentist?
They are all general
General.
slots.
Okay.
And how long have they served?
So Miss Katz will be her first term. Mr. Markuson, I believe, is his second term. And Miss Gaffney has been on, she's served the longest. She's been on since 2013.
So there's an opportunity to have that conversation in a year with some diversity as well. That you can roll people that have been there for a long time in service, and I'm not saying that they shouldn't be appointed. It's just, it's always nice to have new people come in with different backgrounds and
different perspectives.
And I'm very
fresh
sensitive.
eyes.
Yeah, and I'm very sensitive to the fact too that, people come and volunteer and they just get their sea legs and we say, no more, yeah. So I'm sensitive to that too.
And I also understand not attending the board meetings, but you can watch the live videos. Before I came on the county board for like it's 4 years.
I will defend that and say she served on Board of Health. She probably felt that she had the experience that, I mean, she served a couple years. So.
Okay. Was it 2 years? Because she said she ended the term.
2019 and 2020.
Okay.
Yeah. Ms. Wegner, did you have another comment?
I am conflicted. I think they're all three very good. Like it's been talked about, I think it would be great to have diversity, but on the other hand, the experience. And if people are willing and they know what has been, what the plans are, what the future looks like, and they've been talking about it, I tend to say that we should go with the experience. And I think that would also give Ms. McClain, a year to watch the board meetings, get up to date on all the other stuff. I admire her restaurateur experience and all of the stuff she does, but the board is also more than that. So I would like to make sure she's up to date on all of the health department initiatives. And I know sometimes, you know, like you said, when we jump in and we're elected or we're appointed, it's a fire hose of information. So I don't know, I just think the Board of Health is on a good trajectory right now. I'd hate to change it.
And I'm just going to add, you know, Cecilia really was much engaged and involved in that, you know, shared table. She brings really great insight into bringing all of those organizations together, you know, and help. So I just share that with you.
And I'm really encouraged by next year having 3 openings and 1 person serving this really long time. We don't have term limits, but that would be a good time to look at that.
I wonder if there is an informal way to attach an advisory group. I mean, I don't know.
So we do have a retail food restaurant advisory committee. It's ad hoc. I know somebody asked a question, I think, about education. So we have just started a new virtual office hours with restaurants, and we're doing some education. And Patty shared with me the other day, 124 people signed up for this first one.
That's great.
So that's super exciting. So that's another opportunity for us to reach out to restaurants. Hopefully that kind of excitement will continue. So we're incorporating education into that. So things that are relevant or updates to codes, things like that, that we can hopefully engage people. It's other health departments have been doing that, and we heard about that idea, and so brought it forward, and so we're testing it out.
That's great. That's good.
Well, thank you for everybody's comments. We have 3 great candidates. I really do believe that having a diverse board and representation from a community that, you know, is a big part of the health department's purview is important. I think Ms. McClain would be a great addition. I guess so with that, we do have a motion on the table. Do a roll call, maybe?
Could you read the motion back?
The motion was for Ms. McClain. It was made by Hendricks and seconded by Shorten.
Why don't we do a roll call, because it looks like it might be.
Hendricks?
Yes.
Ness?
Yes.
Wagner?
Do you understand what the motion was?
What?
Was to appoint.
I can't hear.
The motion was to appoint Ms. McClain.
Oh, the motion was to appoint Ms. McClain. I'm very sorry. No.
Wagner?
No.
Van Hoff?
No.
Shorten?
Yes.
Altoff?
No.
Von Bergen?
Yes.
So we have 1, 2, 3 yeses and 1, 2, 3, 4 nos.
I'll make a motion to appoint Mr. Clarke.
Second?
Should we do it?
Why don't we do them together?
Sure. Mr. Clarke and Ms. Carman.
Together?
Yes.
And second.
All those in favor?
I do a roll
Do
call.
we need
keep it
to
consistent.
do it? Okay, all right, we'll do a roll call.
Wagner?
Yes.
Van Hoff?
Yes.
Ness?
Yes.
Altoff?
Yes.
Von Bergen?
Yes. Okay, thank you, everybody, for good discussion. Sorry we didn't use your talents there.
I was ready to go.
Mr. Hartman, I know, you look so excited.
I need to step out.
Okay. Okay. All right, it looks like we are at presentations.
Buckle up.
So, Carrie, would you like to join us at the table?
I know, and I already have to apologize. We tried to figure out which meetings, which meetings to attend where we would see all board members, but not too many duplicates. So a few of you have heard this already, but
I have not.
Some of us need to hear it 2 times.
I think, Pam, you get to hear it 3 times.
Well, some of us need that.
Okay, so as we are finishing up the audit, we're starting to look forward to the budgets. And last year, we kind of took the approach that we were going to move through pretty quickly, but some of the feedback I received and some of the questions, I think that was to a little bit of the detriment of the newer board members. So we're still going to plan to move through the committee presentations fairly quickly, but we're going to change up the format a little bit. So we wanted to give you a heads up because maybe June, for sure July, when you start to see your first budgets come through, we will have links in the packets to all of this information. So it's really the same, it's just different. So we wanted to make you aware. So when you're at home, you can always come in and find the link under the finance page under budget. Once we have everything open, there'll be a link here for the 2025 draft budget. So when you click on that, it's going to bring you into our open book tool. So if you click on this, and unfortunately we have our budget document in ClearGov software, and then we have our budget data in Questica, and they're not fully integrated, but I think each of them, what we use them for, are really good tools. So this is to kind of help bring those together. So, I just write a little bit about why we have to do it, what's required for the GFOA. And then this year, based on some discussion last year in the strategic plan, we're gonna have more of a focus on the departments, their functions, and their services. And so the tool in ClearGov is really good for that information. So the link here is to ClearGov, and this is actually the tool we use to build the full budget document. But for the draft budget, we just went in and broke out the piece for just the departments. So if you go to any of the departments, you can see, and this has been in the budget document for several years, but when we sit down with the departments, we want them to kind of review, enhance, talk about what's mandated, what's not, some of the impact of what they do. So really just take this information and expand on it.
And I wanted to jump in because I missed this the last time you made the presentation. Part of our strategic plan is to evaluate programs to make sure that they're working, whether they're mandated or not. But the evaluation and your conversations with those departments and then the information that's put within the budget, I think makes it easier for us, to see whether or not we're getting, a bang for our buck and what's working and not working and where we need to maybe focus some of our attention. So I appreciate that, Karen. That's
and ClearGov is really a good tool because I think, as I mentioned at Law and Government, when you print out the full budget document, it's around 400 some pages. And so while there's a lot of good information, it's a lot. So this tool really helps you to be able to find what you're looking for a lot faster. Because a lot of the feedback I received from some of the board members was they didn't really know what questions to ask. I think because, as Kelly said, the fire hose of information, it's just a lot. So this hopefully will give you a better tool to see exactly what we're talking about when we're giving you all this information. So the focus is going to be the function of the department, but then it's also going to be the highlights and goals, the FTEs that you've always seen, and then the org chart. So we will still have a printed version of this in your packet, but you'll also have a link to this, as I said. So that's the non-financial information, and then the financial information will still be in Questica. And we'll have these links. These are links where you can actually go into Questica, and then these are just some high-level ones. So I really tried to make this spotlight apply to, some people want a lot of data, some people just want high-level but easy to get to. So hopefully this fulfills that. So if you click into here, this brings you into Open Book in Questica. And this is, obviously it'll be 25 budget once we open it up. So you can start with high level, like the funds. Like if you just want to look at a specific fund, and then if you click on that, it'll take you to the category within that fund. I think that's the list. So again, we present a lot of information by fund and category. So I tried to stick with that. But then if you want more information, you can drill down further. Or if you want to go to fund, department, category, and then main account, which is the most detail that we have within our budget. So again, it's a lot of information, but hopefully if you're just looking at a specific fund or a specific category, you know, it's easy to see. And you can look at it this way. I don't know what the percentage is. Different ways to look at it. And also too, there's always the option to export the data. And this just is a really raw look at all of the information in Questica. So then you can filter and look at it however you want. My one note on this is, you know, just be wary that like all of the funds operate as their own entity, really. So, you know, look at fund specific if you're looking at one thing, or within the general fund especially, because there's so many departments. You know, one thing may go up because something else went down. So, you know, I'm always available if you want to talk about this. We can go through every line. You know, I would like to do that. Or if it's categories or something, or if you know, have something highlighted, but you still don't know exactly what questions you want to ask, maybe, you know, we can talk about what you have highlighted, and that will maybe lead into, you know, answering the question. That's hard to come up with terminology and all that,
So this happened to me in law and government too. When we're talking to get to the information you were just adding Questica, is that supposed to be the link, the 2024 budget interactive?
That should take you to Open Book. So this is a link directly to the budget. If you want to get back to the page, and this, if you click up here on this McHenry County.
Because that's not working for me. And I don't think it worked for Lynn.
The McHenry County one?
Yeah, just the budget, the 2024 budget interactive. It might be just me, but it's not, maybe. I'll check in a different browser.
Where's the initial link?
If you go to,
oh, sorry.
Yeah, the county webpage, under finance, and then if you go to budgets, you can go to, so this brings you straight to the budget, but if you want to get back to that spotlight where you have all of the information, it will bring you there. But I will look and see, because this has no security. Like I'm not logged in right now, so maybe after the meeting we can.
Yeah. And also one other thing, could you send all of us maybe the links to these, so we have them in our email?
Yes, once we get, so right now, obviously, we don't have the 2025 budget open yet in Questica, but once we have that, then all these links will be out there, and I'll send them to you. And then they'll also be in your packet too.
Okay, thank you. Yeah, it says Questica, it can't be reached. Maybe it's my computer.
I can't get to that or the other one. My connection is timed out.
That's what happened to me too. Yeah, so I'm wondering maybe
Do
we have to be at a certain.
Yeah, so let me,
or something.
let
I'm
me
on
talk
guest.
to IT about that because I actually had trouble logging into the actual application. It was a similar message, but you shouldn't have to log in. So I will follow up and get an answer for you.
And then,
So should we be able to get there from the iPad, or do we have to be on our laptops?
You can actually get to it from even your phone.
Right.
Yeah.
Really? Okay.
It's just a web.
Anybody should be able to get there, right?
Correct. Right now, both of these are actually public.
So I got to the old
Okay.
one, but I haven't looked at this one yet.
Okay.
ClearGov is
try it.
asking me to sign in when I typed in what you had in the address up there.
Okay.
and one of these, I think last year when I downloaded the Excel data and the expenditures, when are those updated? Is it quarterly or?
So, that's my
Because I think.
my biggest pain. So
Yeah.
we have, there's this, the way we report our encumbrances is a little bit different than Questica, I think, is set up.
Okay.
So we actually have a custom column. So this data gets passed from D365 every night. So it should be updating every night. The problem was that custom column had stopped updating, but
Okay.
I threw like a temper tantrum, and so now it's.
I doubt.
I said, you know, I said that to a board member.
Temper tantrum. I'm sure one of us got thrown under the bus.
No, it's just, yeah, it's.
If anyone, it was probably me, I would imagine.
No.
I don't think any names were named.
It was,
A board member.
it's been an ongoing
name.
problem with
Young
Questica,
attorney.
and so it was just kind of highlighted with that, and I was.
Because I remember last year, I can't remember like specifically what it was, but when I was, we were towards the end of the year, and then when I opened it up and the expenditures were
So
half of what was budgeted
The
for almost
year-to-date,
everything.
yeah, the year-to-date custom column had stopped updating.
Okay,
But there was no warning that it had stopped updating, so.
so ideally, in a perfect world, if it's working correctly.
This year it will, yes.
It'll be accurate as of
Each
that
night,
day,
yes.
or that night, yeah, okay. Cool.
So any other questions? This is the most exciting committee I've had on this.
Imagine that.
All right.
Thank you.
Sure,
Coming
thank
in.
you.
And thank you for all the little nuancy things that you worked with them to give us. It's appreciated.
Well, I know that, my finance brain sometimes, I just like to see the numbers. Sorry, Dan. But the more I get into like presenting stuff to you guys, having it a little more, not to imply that you guys need pictures, but well, more like targeted writing, just because, again, it's so much information, just easier to look at, so.
Yeah.
And just, I would, and not only do we have to understand it kind of sort of on one level, we have to be able to interpret it and share it with others.
Yes.
And that's where the more information we have, the better off we are, so.
Yeah, and really these
appreciate
tools
it.
are meant for the public, that aren't so involved in it, to be able to come in and get at least like a high level idea, so.
Thank you.
Okay. Now we are on reports, workforce housing. I think that falls on you.
We're at it next month, right? Next month you should
Okay.
actually have
We get the white paper?
a draft in front of you, and I do say draft for your input and comments. I think we've done a remarkably lot of information, and we tried to keep the pages and lots of pictures and graphs. Which is why maybe I'm so sensitive to that. But it should be in front of you next month with the idea that you'll approve it, and then we take it to the committee of the whole meeting, the next county board, which would be July. Yeah, which when things are quieter and you can ask lots of questions. And we have invited, so you do know, we have invited the participants of that task force to attend that meeting so that they will be in the audience. And obviously they have much more information than either Lou or I could probably provide well. So they'll be there and you can ask questions of them too.
At the
As
committee of the
to
whole
what they
meeting.
see at the committee of the whole meeting. Yes, ma'am.
Great.
Yes, ma'am. And they were invited to the committee meeting too,
Okay.
although I think that there'll probably be better attendance at the whole committee of the whole.
Yeah.
But yeah, with that idea that you'd want to see who they are and their content.
Wonderful. I have a question that's kind of off topic. I just wanted to ask Pete, when is the 2050 plan coming before the board?
Around that time.
July, so we'll have
So
to,
this is not
okay.
gonna be like a
It could be that
quiet.
same.
Yeah, but actually, you know, we did do that. We looked at what the 2050 plan talked about with housing, and then we looked at what we did. It's amazing, and we never spoke. And it's amazing the correlation, how that worked out. So it's actually, it'll be an interesting conversation. So thank you.
Well, I wish Lou were here. Thank you, the both of you, for spearheading that and for all of your input, Scott, and of course, everybody on the committee. I'm really excited to
We're gonna
see.
ask you, however, whatever iteration, you're the chair, but one of the recommendations will be to continue to have some kind of task force, committee, subcommittee, ad hoc, whatever you want to call it, to continue, because this is just informative. The next iteration would be, how do we take this information and how do we apply it? What kind of programs can we come up with that actually will assist the county take a lead in working with our other communities on affordable housing and providing that for our individuals? So, yeah, and again, I have no vested interest, that's for everybody else. But I do believe that we do need to continue those conversations and come up with some really viable options.
Mr.
I
Herman?
think if Lou were here, she would say it's a long game.
Yeah. Thank you, it is, it is.
Yeah, I think she just said she had to step up for a minute. I thought she was doing that.
She took a
Yeah, I know that. I saw that.
I saw her dipping out, so.
Oh, she's gone.
That's all right, sorry, Lou.
Okay, great. Well, I look forward to seeing that. I'm sure everybody else is.
And if we can, maybe can we get it out earlier to the committee? I mean, there's a lot of information and a lot of pages. Maybe if we can get it done, we can send it out to committee members in advance of agendas.
I think that would be a great suggestion.
We do that, yeah. And then you'll have time to really look at it and be ready for conversation and comment.
And study those pictures.
And study those pictures, those graphs, we did good.
How many pages would you say?
I think it's 12, but that's including cover and everything. The intent was, we could have made it 80 pages.
Right.
The intent was to keep it boiled down, hit the
Focus.
facts, hit the numbers.
Info.
And a lot of the data is presented graphically, because if I were to write it, I'd have pages of numbers.
So next time I have to do this, I just have to do this in my doctorate program.
What we really tried to do is identify the problem, give you specific McHenry County information, and then some of the ideas and challenges that many of the developers were experiencing. So we really did, the idea is to give you the info to identify that there is an issue. And now what do we do, right? And what other entities have done. Many counties are actually designating dollars to do something. We may not have to do that. We may be able to give people resources through shared services.
Okay. All right, are there any future topics on the table that anybody is?
Would you guys, I don't know, I'm gonna do this now. You're gonna get yelled at me. We've been having, in public health, we've been having some really great presentations. And I have to tell you, the first one I kind of went, oh my God, what do I need to know this information about bird flu? It was phenomenal. And then 3 days later on the news, I saw this big thing and I actually knew what they were talking about. Would you guys be interested in some of those presentations? you know, on what's going on and kind of, you know, how the public health is dealing with those. I mean, you talked about the overdose, maybe we could just pick some of those and bring those forward at some of the committee meetings. Yeah, it was amazing information, and I'm telling you, I did not approach it with an open mind.
And one of the things that I'm really interested in is the program for diabetes. Is there any way that we could learn more about that?
So you can learn about all these things. I guess my question is, do you want like I don't know if it's a standing agenda item, like how do you want it handled? Or do you want to pick the topic, let me know, and then I will coordinate.
Why don't you coordinate with,
Yeah.
yeah.
I can coordinate with you.
Okay.
We can pick
Sure.
some topics and.
Yeah.
And if you can plan it out, that helps, like if like, you know, in June you want X topic, July, that will help us get staff scheduled.
Yeah.
I think that you can start with diabetes, you can start with our overdose data. Maybe that's also the coroner too. I mean, your coordination.
Well, they
I
all
don't-
work together,
I know,
so yes.
that's what I mean. Maybe he comes too. I don't know. I leave that to you guys. And then some of the data and information on disease that's going, you know, just in a, yeah.
Current
I mean,
events.
those are 3 things that you can figure out. But
So-
at least there's been
We
interest.
should always have
So
a
with
current
the
event
diabetes, I know
line
the
item.
person who developed that got recognition, statewide recognition. It was at our county board and everything, and that is rising. I'm doing a lot of research on that.
And we're expanding our chronic
It's
disease.
going up and up and up and up, and it's correlating with obesity.
So we could have them come in and give you, touch on diabetes in particular, but give you an overview of how.
Other chronic illnesses.
Yep.
Cool.
And then also maybe an update on COVID, what we're still doing with data, how we're still tracking it, and how we'd be prepared for any other. Because you guys.
Don't put that in the universe, Pam. But yes, we're always preparing
It's
for the
always
next thing.
in the
Yes.
universe, yeah.
Well, I was
Yeah.
interested when the nurse was talking about long COVID and the medicines and doctors refusing to give those medicines. That's really interesting.
But that's the only thing I can think of.
Okay.
That's
So
Great
interesting that
suggestion.
no one has died at J&J, the J&J vaccine.
really, I didn't know that.
I'm all over that. I did J&J because I have a great immune system and I didn't want to give a heavy dose.
All right, we have no need for executive session, so I'll take a motion to adjourn. Ms. Wagner, Mr. Short?